human vaccine trial has shown it to be more than 90% effective.
Drug giant Moderna announcing their vaccine trials show that it is nearly 95% effective.
We now have a vaccine that is more than 90% effective.
90% is a game changer.
It's a lie. They're lying to you. These vaccines that are coming out, these are terrible vaccines. These are mRNA vaccines.
Our problems here is the assumption that this is like every other vaccine we've ever seen. And it's not.
It's the greatest experiment that has ever been performed in the history of medicine, and it's being performed on human beings. It's just an incredible thought.
So all of this started to come together, and we started to get kind of a sick feeling in our stomachs that, wait a minute, this is science gone bad here. None of this is supposed to be happening. The CDC has never otherwise explained these deaths, and they are so tightly related to the vaccine.
For many years, millions around the world have erroneously believed that vaccines are safe and protective against diseases and infections. But with the advent of COVID-19, the world has since found this to be a great fallacy. When the fake pandemic was unleashed on the world, the perpetrators projected themselves as self-acclaimed saviors, and presented a solution packaged into vials as vaccines and enforced them on an unsuspecting world as the solution to the crisis.
This is not new. It's been on for a long time. The thing is, the deception has been on and on and on. Now, they're even so bold to come out to reopen.
We're taking things that are, genetically modified organisms, and we're injecting them in little kids' arms. We just shoot them right into the vein.
For the world at large, normalcy only returns when we've largely vaccinated the entire global population.
Nobody will be safe if not everybody is vaccinated.
Virtually everybody is going to wind up getting exposed and likely get infected. But if you're vaccinated and if you're boosted, the chances of you getting sick are very, very low.
Well, this won't be the last pandemic that we face. So we'll have to prepare for the next one. That, I'd say is will get attention this time.
Those who were listening to that caused this havoc, they have no solution. They have no solution. They have no direction. And they are irresponsible. Irresponsible. They created the previous crisis and created this one and complained about the previous one.
When you look back at the history of medicine, prior to the advent of petroleum products and chemicals, we were all natural healers. Doctors were taught to heal using natural chemicals. And I think this goes back far beyond our view. If you look at the Rothschilds, they are descendants of the Kazakhs, Luciferians. So this is a nefarious agenda from a long time ago. They got classified as Ashkenazi Jews. They took over the economies of the world. The Rockefellers got involved with petroleum. They discovered chemicals and decided to then finance with all that money the universities. Yeah. They made all the treatment used at the time alternate treatments. They forced universities to teach the allopathic way of treatment. Doctors were coerced. And so, chemicals have infiltrated every part of our existence. And so I think the public is unaware of what actually is going on around them. I mean, the simple thing like rubber soles keeps us from contacting the ground anymore. Our water supplies are contaminated. Our fish supplies, we use detergents for everything. We don't respect the microbiology around us. So when you look at the medical profession, it's been narrowed down to allopathy, which is a very simplistic, narrow view of what the universe actually is. And I think to be a true healer, doctors need to broaden their horizons and their scope. And I think patients or people, humanity as such, need to reassess what they truly believe health actually is. Vaccines were a non-starter. Vaccines were meant to prevent infection and transmission. None of them do that. So it doesn't say what it does on the box. And so it's not a vaccine. So vaccine preventing severe illness, my medication does that. There's simpler, less invasive methods to prevent severe illness and death. So we need to relook at everything that we told.
The scourge of vaccine mandates have been on for more than 100 years. As far back as the late 19th century, research reveals that just as terrible as the vaccines are today, they were just as terrible in those days. But in spite of the dangers, the vaccines were still mandated by the governments in connivance with the vaccine production companies and regulators of the day.
This building that you see behind me in this slide is a men's prison today. But in 1871 was the prison where the fathers who refused to vaccinate their babies and couldn't afford their fines were incarcerated to serve out their sentences. The people of Leicester, after years of fighting for their human rights, overturned compulsory vaccination in 1889. In 1871, the town of Leicester had 200,000 people, no sewage, no clean water, putrid drains, and a 110% vaccination rate. You heard that right. Everyone was vaccinated, with a few who had extras just for good measure. Up until 1871, only 7 babies were not vaccinated, and fathers were imprisoned. In the year 1871, one of the most severe epidemics of smallpox on record occurred during an era of meticulously documented statistics, and it happened following 33 years of official compulsory vaccination. 3,000 cases of smallpox occurred in 1871, and 358 people died. Until that point, even though parents hated the vaccine and were horrified at the side effects and deaths of their children from it, they believed that the disease was worse than the vaccine. 1871 put a stop to that thinking, and Leicester residents began to rise up and say, "We are not going to continue to sacrifice our children to a deadly and disgusting vaccine that doesn't even work."
In the wake of the carefully concocted pandemic, the world was deceived into believing that the vaccines were created in response to the COVID crisis. But in effect, the vaccines were created long before the COVID pandemic was ever hatched.
This vaccine has been ready since. So they're just telling you it's hard. They're working hard every way so they can come up with it. They're working hard. It'll take 18 months before it's ready. Then we go, oh. Then they say, we're going to try. In 10 months, we will try. Then you say, please do. Then finally, they say, it appears we might even have a record time, 6 months. Then we say, that would be a miracle. Then in 3 months, it's ready. What I told you, he was there all the time. He was there all the time. What do I mean he was there all the time? They were working on a vaccine. They already had a vaccine that they wanted to give out. The problem is what that vaccine is about.
Dr. Barrick signs a government deal with Moderna. I want to read it exactly to you. This deal was made. It's confidential. It's 158 pages long. It is, if I skip to page 104, they are entering a specific private confidential agreement. The NIH appears to be transferring technology to Dr. Barrick, but what they're making clear is, quote, mRNA coronavirus vaccine candidates developed and jointly owned by NIAID and Moderna. Now, this is weird because it's 2 weeks later that we know there's a problem. They signed that deal 2 weeks before, and they signed it with the doctor who happened to be a partner with the bat lady in Wuhan.
So the introduction of the vaccine, I told you from the beginning, it was not because they wanted to treat you. They weren't trying to help you. I said it's a ploy to bring in something to have some control over you because they want to introduce something into your body. They lied that what they were going to put into the body, the jab, that the substance will remain local. It wasn't local. It traveled through the whole body.
We must acknowledge that the COVID-19 genetic injections cause far more harm than good, and provide zero benefit relative to risk for the young and healthy. They do not reduce COVID-19 infection, which is treatable and not terminal. Furthermore, the most recent data demonstrates that you are more likely to become infected or have disease or even death if you've been vaccinated compared to the unvaccinated people. This is shocking to hear, but it is what the data are showing us. The data now show that these experimental gene therapy treatments can damage your children as well as yourself. They can damage your heart, your brain, your reproductive tissue, and your lungs. This can include permanent damage and disablement of your immune system.
The beginning of this pandemic, vaccines used to be, when it's against a viral illness, it was either a dead virus or a weakened virus that was injected into the body. And that virus that was either dead or weakened could not make you sick, it couldn't transmit the disease, but because the immune system would come in contact with it, you would develop antibodies and cellular immunity to that virus. That is the principle that vaccines have always been made of, dead or attenuated organisms. What we now have as COVID vaccines are a completely different thing. And that is why so many people say they should not be called vaccines. And I'm one of those people. I think it is wrong to call them vaccines because what they consist of is synthetically created viral genetic material. So the Pfizer and Moderna vaccines contain viral RNA. The Johnson & Johnson and AstraZeneca vaccines contain viral DNA. So it's genetic material of a virus, and that genetic material has been created in a laboratory. So it's synthetic. Now, we also know that the RNA in the Pfizer and Moderna vaccines is not identical to the RNA of the SARS-CoV-2 virus. There are certain changes, and we also know what those changes mean. Effectively, they make the spike protein more pathological, more toxic, or more dangerous. So the way these vaccines, if that's what they're called, work is a completely different mechanism. The genetic material is encapsulated in a lipid nanoparticle. That's what Dr. Rapiti spoke about. That goes into your cells, and then inside your cells, you produce viral spike protein. So in other words, this induces your human body to become a factory for spike protein.
But the deception has been on and on and on. I'll tell you why this is happening now. Because God is fed up. Too many have been killed. Too many have died because of these vaccines. Too many have been maimed because of these things.
16 to 24-year-olds who received the Pfizer or Moderna vaccine have experienced higher than normal cases of myocarditis and inflammation of the heart muscle.
The one truth you won't be told, they carry on forcing people to have this shot that has now broken all records for vaccine injury and death and is clearly not working. None of this makes sense.
We are in the middle of the largest experiment in human beings that has ever been performed, full stop.
While vaccines have been insincere from the beginning, the mRNA vaccines were created with a predetermined goal in mind, and this was to depopulate the world and control the lives of those who escaped death by these death-inducing vaccines.
I'm telling you, the vaccines were tested, and I want to tell you what happened. They tested the vaccines to be sure it will do what they wanted them to do. The vaccines are actually doing what they wanted done. You are thinking that they should have tested the vaccines because they're experimental. No, they used the term experimental to escape legal problems. That's why. They didn't rush them out. No, they were well tested for the purpose that they designed them for. So let's not say that they should have tested them, they're not well tested. No, no, no. We are buying into their lie. They were well tested for what they wanted. And after they tested them, they decided that, yeah, this is good for what we want to do. I told you, the vaccines were never designed to prevent infection. I told you. The vaccines were never designed to cure. The vaccines were never designed to stop the spread. All three things that they promised that these vaccines were supposed to do, it was all a lie from the beginning, and I told you that.
When you use a term like vaccination, the public thinks that means I'm getting something that is going to stop me from getting sick or keep me from transmitting that sickness. That's cunningly what vaccination means. And it's actually defined in the statute as exactly that. It's actually the ability to put something into the body that stimulates the immune system. It turns out that the mRNA that's being injected into people is not that. In fact, specifically what it does is it takes a little computer-simulated strand of mRNA, it sends it into the body, and the body becomes a biological weapons factory. It manufactures spike protein. The injection does not stimulate any immunity. It actually is the instructions to make a scheduled pathogen. We have a decade of data that shows us that mRNA actually can transcribe into DNA. Using the term vaccination was intended to essentially mislead the public.
What I can tell you, because I've analyzed this very carefully, and this is all contained in papers submitted under oath to court, that the claim, not only of the South African government, but the CDC, the FDA, Pfizer, all international governments, which was that the vaccines are safe and effective. I'm sure you all remember those words. They kept on being blurted out on the news, in the newspapers. Every time one of these clever professors spoke, they always used that refrain, safe and effective. What I can prove by using Pfizer's own data, not anything outside of Pfizer, and their own data that has been published in a peer-reviewed journal, is that their vaccine is not safe and their vaccine is not effective. And worse than that, also their own data proves that their vaccines cause more harm than good. There have been similar evaluations of the Moderna trials and of the Johnson & Johnson trials. In all three cases, Pfizer, Moderna, and Johnson & Johnson, analysis of their own trial data has found for each one that they cause more harm than good.
Yeah.
So how the health authorities and the doctors and the governments manage to hoodwink the public of the world that something where the trials prove they cause more harm than good, they're not effective and they're not safe, how that has been perpetrated and the world has submitted to it is a tremendous mystery to me. But however they achieved that, the one thing that is clear is the data of the vaccine manufacturers proves that their injections cause more harm than good.
The Fifth Column recently published their findings and conclusions on the strange self-assembling nanotech they discovered in the Pfizer mRNA vaccines via optical microscopy analysis. The objects they found in the vaccine correspond with known items in the scientific record, and the conclusion they come to seems quite clear, that the well-documented scientific goal to use nanotechnology in living human beings to form networks capable of controlling several nanomachines is currently being deployed in the COVID-19 vaccines, which amounts to the most intrusive assault against humanity in all of recorded history. While the media and government lie and cover for Big Pharma, the official ingredients are still unknown. But we have thousands of brilliant scientists worldwide studying these experimental vaccines. Some have died in highly suspicious ways, but most have been able to share their findings. And the work shows us that graphene oxide is a key component in all of this. There have been dozens of official documented studies on the use of graphene oxide related to how we see it being used here today. Among other things, as a power converter. Graphene, A 1-atom-thick layer of hexagonally arranged carbon atoms is the thinnest and strongest material known to man, and an outstanding conductor of heat and electricity. It can boost gigahertz frequencies into terahertz, which is exactly what these new nanotech machines need for power. In order to do this, the graphene first needs a frequency to power it, and the optimal frequency to externally power graphene is known to be 26 gigahertz, which is also the frequency put out by 5G. In this model, the graphene within the body is activated by microwave signals in the gigahertz range, which it then boosts into the terahertz range, which then powers the novel nanotech machinery to self-assemble within the human body. Once assembled, what do these nanotech machines do? The images, compared to the scientific literature, suggest that they are the foundation of an internal electronic system with an endless potential for biomanipulation of the human host. Nanorouters that emit MAC addresses, able to be registered via Bluetooth. Nano and plasma antennas to amplify signals. Nanorectennas acting as rectifier bridges from AC to DC current. Codecs and logic gates for encryption of communication. The raw material for all this self-assembly is also graphene oxide. And when we compare known side effects of graphene oxide to the side effects of the COVID-19 vaccines, we find them to be the same. Once graphene oxide is injected into the body, it acquires magnetic properties, predictably around the injection site, the heart, and the brain. Graphene is seen as a pathogen by our immune system and will often result in paralysis and stroke. Graphene is known to cause blood clots and heart conditions. Graphene oxide can generate small discharges, causing cardiac arrhythmia. There is so much going on with these experimental vaccines, and the evidence seems clear that there is a mass experiment going on, with certain batches marked more deadly than others, and with certain batches that contain a bold new technology akin to a man-made parasite intended to control the host human if it doesn't kill them first in the process. Perhaps that is what the mad scientists and psychopaths are after. Human genetics that can withstand this new invasive and deadly nanotech.
My name is Bob Snow. I'm a captain for a number of years. My total service with the company is over 31 years. On November 7th, I was mandated to receive a vaccine. Quite literally, I was told if I did not receive the vaccination, I would be fired. This was from our director of flight. So, under duress, I received the vaccine. Now, just a few days ago, after landing in Dallas, 6 minutes after we landed, I passed out. I coded. I required 3 shocks. I need to be intubated. I'm now in ICU in Dallas. This is what the vaccine has done for me. I will probably never fly again, based upon the criteria that the FAA establishes for pilots. I was hoping to teach my daughter to fly. She wants to be a pilot. That will probably never happen. All courtesy of the vaccine.
Fully intent on their sinister agenda and the hideously resultant effects in the destruction of so many lives, the big pharmaceutical companies indemnified themselves against legal actions that would be meted out to them as penalty for their wicked.
Clearly, vaccines have a serious safety question or issue.
But the studies that the FDA requires, that the CD requires, are completely insufficient to ensure even a certain threshold of safety for vaccines.
If they were not unavoidably unsafe, they would not need liability protection. The Supreme Court in the Bruchewitz case say 32 times that vaccines are unavoidably unsafe. And if any thinking person considers it, that's the reason vaccines have liability protection in the first place.
We have a vaccine injury compensation program that has paid out $3.5 billion over the course of roughly 27 years. And just last year, fiscal year 2016, it paid out over $251 million because of people who are injured or killed by vaccines.
If you suffer severe side effects after getting the COVID vaccine, there's basically no one to blame in a U.S. court of law.
Take the vaccine makers. Health and Human Services Secretary Alex Azar invoked the Public Readiness and Emergency Preparedness Act in February of 2020, which protects the makers of COVID products such as vaccines and treatments from legal action. This protection lasts until 2024.
Essentially, in order to encourage companies to get into this space, to develop vaccines for the good of the public, for the public health, the government comes up with a program which immunizes those companies from liability for any injuries or damages caused by taking the vaccine.
That means for the next 4 years, companies like Pfizer and Moderna can't be sued for money damages in court over injuries related to the administration or use of products to treat or protect against COVID-19.
The aluminum that we put into vaccines is a different kind of aluminum that we see environmentally. This is called a nanoparticle, and nanoparticles bind really tightly to the bacteria antigens, the virus antigens, the food protein antigens, and any other contaminants that are in the vaccines that we may not know about. And we know that the biochemical properties of nanoparticles is that they are capable of entering the brain. And so we have not evaluated the safety of the aluminum nanoparticle and its injection and where it goes when it gets into the body and whether it gets into the brain. Do vaccine ingredients belong in the brain? No. Do they get into the brain? No one has ever studied it. But animal studies using the same chemicals that are in vaccines that we give to children directly demonstrate that the vaccine ingredients do enter the brain. We are ignoring this information. There are scientists in Europe who've actually done studies on the aluminum nanoparticle and have shown that it can persist in the brain for years and decades. And so what we're seeing is a large outbreak of neurodevelopmental disabilities in adults, including Alzheimer's. And one of the main factors that they're finding in the brains of people with Alzheimer's is the aluminum nanoparticle that's directly related to the vaccines that we're giving.
We got regulatory bodies who are not there to actually do the work for society. SAPRA is supposed to make sure everything's safe and effective and safe for the public. They haven't done that. They want to now get into the realm of nutraceutical products and regulate that. I think they realize that nature's given us answers and they don't want us to have those answers. It doesn't fulfill their agenda. And so I think, yeah, everyone around us needs to take ownership. Take ownership for your own health.
Each one of us should take ownership of who we are and start taking care of ourselves. Don't just accept things that are thrown at you. Don't just accept the media. Don't just accept what you're reading in the newspaper, because that clearly has not been the truth. And there's a lot of deception and there's a lot of manipulation, both of information as well as manipulation of things that are on the market for us to ingest. So do your research. You know, I have patients coming in with their own articles. So do your research, look it up. There's a lot of places that you can go to where you can look at risk factors, a lot of places that you can research what has happened to the previous people. You can actually look at, you can actually go to Bayer's, you can go onto Bayer's and you can download all the side effects and how quick the side effects have taken place. Some of them are very acute, within hours people have died, or some of them have taken much longer. So do your own research.
While the adversary tirelessly advances with these evil works of darkness, God's people more than ever must remain resolved and courageous in the fight against these ills in our societies and look to God's word as the ultimate solution for their health.
The world in which we live today has a lot of wickedness, so much wickedness. Deliberate destruction of lives, and then they come in with all these kind of things with the vaccines they're telling you about, with which they have maimed people, killed people, crippled people. Lots of sicknesses that people have never known about coming to them, and these things are deliberately being spread. And you better know the word of God now for yourself, because this is what's going to keep you afloat and beyond others.
Therefore put on the full armor of God, so that when the day of evil comes, you may be able to stand your ground, and after you have done everything, to stand.